So let's talk about back pain and why so many people deal with back pain when they don't even have to. Back pain is tricky because sometimes the things that initially feel the best to us, that feel like they're really going to help, actually make things worse in the long run. And sometimes the things that feel like they're making us worse actually help in the long run. So understanding that and breaking out of the cycle that's causing your pain to continue forever is very important with back pain. So first of all, let's just talk about scary things that show up on images, right? Scary things that show up on MRIs and x-rays. A lot of times people come into me and they say, oh, I have degenerative disc disease, or I have facet arthropathy, or I have a bulging disc. And a lot of people do have those things. But most of the time, even for people who have those things aren't actually painful. About 30% of American adults are walking around with a disc herniation and they don't have any idea because they feel fine and they don't have any pain and it's not bothering them. You can have several disc herniations and actually not have any pain because of it. Facet arthropathy, or the little arthritis that happens in the small joints of your back on the back of it, usually is not painful. It has to get really bad and progress to the point where it's ankylosing spondylitis or something else that's extremely severe before it actually causes pain. So what causes actually 90% or more of back pain? To understand that, we have to understand a little about how the back is put together, right? So the back is basically a stack of bones. Your spine is a stack of little bones that sit on top of each other that runs up and down the middle of your body. Your hips attached to it, your ribs attached to it. It supports pretty much everything else that's going on in your body. In the back, right in the lower back, where things are the most vulnerable, where you have the most weight on your spine, there aren't any other bones in the body in that level that support you. If you look up higher in the spine where the ribs are supporting the upper thoracic spine, so there's a lot less problems that happen there. Down in the middle, there's nothing really else that helps down there. So what is down here that's supporting you is very important. And what that is really the abdominal muscles, right? You can see there the abs and the back muscles, the spinal muscles, are really all your spine has to take care of itself in that area. So it's very important to understand how they work and what helps them and what hurts them. One of the worst misconceptions about the spine, a lot of people come in and say, oh, I went to therapy, they gave me a knee to chest exercise, it felt really good, I love that exercise. But 90% of the time, that's exactly the wrong thing to do. And the reason why it feels good but isn't good is that these muscles in the back here that are supposed to be supporting your back, your paraspinal muscles run up and down, their primary job is to hold your spine together, right? And when you pull yourself into this knee to chest position where your back is bending forward, you're stretching out those muscles. So it gives the muscles a good stretch and it feels good, but this is actually one of the worst things you can do. One of the biggest questions I get about back pain is, why does my leg hurt? Like, why is the pain running down to my knee? Why is it running down to my toe? Why do my toes feel like they're throbbing and burning and hurting and numb? And it's because of the tension that gets placed on those muscles in this position, right? So when your muscles get pushed forward like this, they stretch out, and that stretch feels good, but it actually puts them in a very compromising position. So if you look at the spine, right, here's your spine. Here are your spinal muscles, your hip flexors on the front, your paraspinals on the back that attach to your spine. So you can see in your arched back position, right, in the position where your spine is extended and bent backwards, that normal safe position of your spine, there's space where these nerves, these little nerves that come out, these are the ones that run to your legs, right? There's space in here where they live, okay? As you stretch those back muscles and put them into that position that feels so good, you can see my nerve now has pressure on it, right? Those muscles are pushing on my nerve. So while it feels good to stretch them for a second or two, if you leave them in this position for half an hour while you're sitting, for an hour while you're riding in the car, or especially for 8 hours while you're sleeping at night where you're laying on your side and your back is curved forward, that pressure that's on those nerves irritates the nerves and it pushes and it cuts off the circulation to your nerves, and now the pain is traveling down your leg. Now your legs are going numb. This is what causes that in 90% of circumstances for back pain. So learning to extend your back into that backwards bent position where it's supposed to be, that makes these muscles on the back here pull harder. It makes them work harder. It makes them do their job, but they're not used to that, right? So that pulling backward, that extra effort those muscles have to do to pull you into this position is initially not comfortable. This is why the things that aren't comfortable sometimes are the most helpful. So when they're pulling you back into that position, they're pulling themselves into a place where those nerves are free. So your back pain may actually get worse for a while because those muscles are working hard. The leg pain for most people is what gets better first. The numbness in the legs gets better first before back pain goes away. The other thing that happens when your back is in that extended position is the joints of your back are actually in a place where they can function better. Every level of your spine has 3 joints. You have the large joint on the front here where the disc is, that allows some back and forth squishy movement. And on the back of the spine, you have 2 joints per level, here and here. These are your facet joints, right? When your spine is in the extended position, you can see those facet joints lock into each other and they create a lot of stability in your spine. Even in this spine model where there's no muscles or anything holding this together, if I extend it backwards into that bent backwards position, that extended position this way, that spine becomes very stable. I can't move it back and forth because it's locked together. If I bend my back into this flattened position, right, or the bent forward position that feels good, that stretches those muscles, those facet joints start to unlock with each other. And now I have play in these levels, right? See how much that moves back and forth? That movement back and forth causes the discs to be damaged because they're tearing now. There's nothing to stop them from hurting themselves. So this is where degenerative disc disease actually comes from. You get your back into a vulnerable position. These back and ab muscles aren't doing what they need to stabilize the spine. So every time you move, every time you do something during the day, there's a little bit more motion in that spine than there needs to be. There's not as much support from the muscles, so the discs start to break down and deteriorate and bulge and push out the back. If I pinch the spine forward like this, you can see how it pinches the front of the disc, right? That pinching shoves the disc out the back and into the nerves. So that forward position, you know, it gets you coming and going. It's bad for your back in several different ways because it takes away the support of the muscles and it takes away the support of the bones. So this is why, you know, this forward position that feels so good for most people, you know, laying on your back on the table, on your bed, with your legs propped up where it flattens out your back, propping your spine up this way with pillows where your head is supported. Oh, it feels so good because my muscles stretched out. But long term, it actually leads to more and more deterioration in your back and more of that pain that runs down your legs. So the good news is that 90% of back pain is avoidable this way. Learning to understand how those muscles work, get those muscles to work, suffering through the initial, oh, my back is more irritated because I'm using the muscles that are supposed to be supporting it while watching my leg pain and leg numbness go away. Getting through all that part and then spending the time to strengthen these muscles and get them to hold you in that position where you're supposed to be and where your back is safest is what will allow you to get rid of most of the pain and go on to a life that's pain-free. Now, there are some circumstances that I'll talk about in some future videos where that doesn't come into play, where there's some structural damage that's gone too far to get you back to that position. And usually those are conditions where surgery is necessary. But for people who aren't going to need surgery, most of the time, like I said, 90 to 95% of the time, this is what gets people better and is a more effective way to treat your back pain. Hopefully this has helped you to understand more about your back and you'll be on to a swift and permanent recovery.